Hey future physios, I hope you all are doing great. I know you all must be worried about the most important, vast and confusing subject, that is pharmacology. As this is the vast subject, I am here to help you all not just to pass but to score distinction in this subject. Yes, you heard it right, you can score distinction. In fact, I scored distinction in this subject in my second year by only studying these questions. So, welcome to my channel, Not Just a Medico. In this video, I'm gonna tell you about all the important questions of pharmacology which were repeated in your previous year's question papers. And I can assure you guys that you can easily score distinction in this subject if you are thorough with all these important questions, as I have included all the frequently asked questions from the previous year's question papers. So without any further delay, let's get into the video. Go grab your books and I'm gonna write down all the questions. You might miss few questions if you skip the video. So without skipping the video, write down all the important questions which I'm gonna dictate. So let's begin. To begin with, let's start with the first chapter, that is General Pharmacology. In this, the important 10-mark question is: enumerate route of drug administration with example. Write the advantages and disadvantages of oral, IV and subcutaneous routes of administration. Yes, this is the only 10-mark question in this chapter, but in addition to this, you have to read about various other routes of administration in detail. Now, coming to the important 3 or 5-mark question, the first question is drug dependence. Second one, prodrugs. Third one, sources of drugs and examples of for each. Fourth one, sublingual route of administration. Fifth one, transdermal patches. Sixth one, drug antagonism. Seventh one, prokinetic agents. Eighth one, first pass metabolism and bioavailability. And the numbers which you are able to see, which I have written next to the question, were the page numbers of the textbook which I have written for my reference. And do let me know in the comments if you wanna know which textbooks I referred for all these second year subjects. Let's continue with the questions. The 9th one, write a note on adverse effects produced by drugs. 10th one, write a note on plasma protein binding of drugs. 11th one, phase 1 biotransformation. 12th one, drug tolerance with examples. 13th one, write a note on biotransformation. 14th one, factors modifying bioavailability. 15th one, advantages and disadvantages of sublingual route. 16th one, enumerate advantages and disadvantages of transdermal route of administration. 17th one, prokinetic drugs. 18th one, drug synergism. And this is all about first chapter. Moving on to the second chapter, which is ANS. In this, the important 10-mark questions are: classify neuromuscular blocking agents and discuss the mechanism of action, uses and adverse effects of pancuronium. Yes, this is the first question given here, but this is of the chapter skeletal muscle relaxants. Similarly, there are few more mistakes, so write down accordingly. Now coming to the second question, which is basically the first question of this chapter, that is classify anticholinergic drugs, explain therapeutic uses and adverse effects of atropine. Third one, classify adrenergic drugs, describe the action, adverse effects and uses of adrenaline. Now coming to the important 5 or 3-mark questions. The first one, anticholinesterase drugs. Second one, dantrolene. Third one, atropine substitutes. Fourth one, anticholinergic drugs. Fifth one, succinylcholine. Sixth one, spasmolytic drugs. Seventh one, general anesthetics. Eighth one, atropine. Ninth one, cholinergic agonist, also called as anticholinergics. And this was all about second chapter. Coming to the third chapter, that is cardiovascular pharmacology. In this, the important 10-mark questions are: first one, enumerate drugs for congestive cardiac failure, describe the actions, uses and adverse effects of glycosides. Second one, classify diuretics, discuss the mechanism of action, uses and adverse effects of loop diuretics. Third one, classify beta blockers, write therapeutic uses and adverse effects of beta blockers. Fourth one, classify anticoagulants, write the mechanism of action, therapeutic uses and adverse effects of heparin and also warfarin. Fifth one, classify antihypertensive drugs, describe the action, adverse effects and uses of ACE inhibitors. Sixth one, classify diuretics, explain the mechanism of action, therapeutic uses and adverse effects of furosemide. Seventh one, classify beta receptor blockers, discuss the therapeutic uses and adverse effects of propranolol. Eighth one, classify calcium channel blockers, describe the mechanism of therapeutic uses and adverse effects of these drugs. Ninth one, classify the drugs used for the treatment of congestive heart failure and explain about digoxin. 10th one, classify anti-adrenergic drugs and explain about propranolol. 11th one, classify anti-anginal drugs and describe the action, uses and adverse effects of nitroglycerin. 12th one, explain in detail the pharmacology of hypertension. 13th one, classify beta blockers, write about cardioselective beta blockers. 14th one, classify drug used in the treatment of angina pectoris and write the pharmacology of nitrates. And the last question is, classify hyperlipidemic agents, write the action, uses and adverse effects of statins. Now coming to the important 5-mark questions. First one, nifedipine. Second one, ACE inhibitors. Third one, uses of prazosin. Fourth one, furosemide. Fifth one, diuretics in edema. Fifth one, fibrinolytics. And I have added few more extra questions, that is, name 4 antiarrhythmic drugs. Second one, name 2 thrombolytic agents with 2 indications. Seventh one, uses and adverse effects of alpha blockers. Eighth one, osmotic diuretics. Ninth one, statins. 10th one, blood thinners. 11th one, calcium channel blockers. 12th one, write a note on digoxin. 13th one, write a note on nitrates. 14th one, write a note on heparin. 15th one, cardioselective beta blockers. 16th one, thiazide diuretics. 17th one, streptokinase. 18th one, diuretics. 19th one, oral anticoagulants. 20th, enumerate thrombolytics and mention the clinical uses. 21, write the adverse effects and uses of ACE inhibitors. 22, write a note on 24, uses and adverse effects of beta blockers. 25, hyperlipidemics. 26, warfarin. 27, cardiac glycosides. 28, classification of hypertensive drugs. 29, labetalol. 30, therapeutic classification of adrenergic drugs. 31, sodium nitroprusside. 32, antiplatelet drugs. And finally, we are done with this chapter. Moving on to the next chapter, that is neuropharmacology. In this, the important 10-mark questions are: the first one, classify anti-epileptics, write the mechanism of action, uses and advantages of sodium valproate. Second one, enumerate the sedative hypnotic, explain the action, clinical uses and adverse effects of diazepam. Coming to the important 5-mark questions, the first one, write a short note on antidepressants. Second one, lignocaine. Third one, neuroleptics. Fourth one, acute morphine poisoning. Fifth one, benzodiazepine hypnotics. Sixth one, tricyclic antidepressants. Seventh one, carbamazepine. Eighth one, write the mechanism of action, uses and adverse effects of phenytoin sodium. Ninth one, lithium. 10th one, again it is a repeated question, so mark it as important. The questions which are repeated twice or thrice, mark it as very important questions. Then 11th one, diphenylhydantoin. 12th one, atypical antipsychotics. 13th one, classify sedative hypnotics. 14th one, chlorpromazine. 15th one, advantages of benzodiazepine over barbiturates. 16th one, drug therapy of status epilepticus. 17th one, mention uses and adverse effects of benzodiazepine. 18th one, atypical antidepressants. 19th one, write the adverse effects and uses of barbiturates. 20, monoamine oxidase inhibitors. 21, uses and contraindications of morphine. 22, anti-anxiety drugs. 23, sodium valproate. 24, phenobarbital. 25th, diazepam. 26th, anticonvulsants. 27, pre-anesthetic medications. 28, indications and adverse effects of morphine. And finally, we are done with this chapter. Now, moving on to the next chapter, that is disorders of movement. In this, the important 10-mark question is: classify skeletal muscle relaxants, discuss the mechanism of action, uses and adverse effects of pancuronium. Now coming to the 5-mark questions. First one, L-DOPA, that is levodopa. Second one, baclofen. Third one, drug-induced Parkinsonism. Fourth one, dopamine. Fifth one, write the actions and adverse effects of levodopa. Sixth one, enumerate the drugs used in Parkinson disease. Seventh one, centrally acting muscle relaxants. Eighth one, treatment for myasthenia gravis. Ninth one, write a note on Parkinsonism. Now moving on to the next chapter, that is inflammatory or immune disease. In this, the important 10-mark questions are: first one, classify analgesic, write the mechanism of action, uses and adverse effects of morphine. Second one, classify opioid analgesics, describe the uses, adverse effects and contraindications of morphine. Third one, classify non-steroidal anti-inflammatory drugs, write the mechanism of action and adverse effects, therapeutic uses and contraindications of aspirin. Fourth one, classify glucocorticoids. Describe the action, adverse effects and uses of these drugs. Fifth one, enumerate glucocorticoids. Mention the uses and long-term adverse effects of prednisolone and add a note on HPA axis suppression. Sixth one, drugs used in the treatment of gout. Now coming to the 5-mark questions. First one, write about the therapeutic uses of aspirin. Second one, COX2 inhibitors. Third one, anaphylactic shock. Fourth one, anabolic steroids. Fifth one, classify non-steroidal anti-inflammatory drugs and mention the clinical uses. Sixth one, write a note on methotrexate. Seventh one, bisphosphonates. Eighth one, celecoxib. Ninth one, mention the drugs used in rheumatoid arthritis. 10th one, write a note on therapeutic uses of corticosteroids. 11th one, prednisolone and its clinical uses. 12th one, enumerate glucocorticoids and their uses. 13th one, NSAIDs. 14th one, glucocorticoids. 15th, aceclofenac. 16th, side effects of glucocorticoids and their uses. 17th one, allopurinol. 18th, paracetamol. 19th, drugs for chronic gout. 20, drug therapy for wide-angle glaucoma. 21, diclofenac sodium, its mechanism of action, uses and side effects. And yes, finally we are done with this chapter. Now moving on to the next chapter, that is digestion and metabolism. In this, the important 10-mark questions are: first one, enumerate oral anti-diabetics. Write the mechanism of action, adverse effects of any two of them. Moving on to the second one, classify drugs used in peptic ulcer. Describe the mechanism of action, adverse effects and uses of H2 receptor blockers. Third one, classify hypoglycemic drugs. Write the mechanism of action, uses and adverse effects of sulfonyl urease. Fourth one, classify oral hypoglycemic and explain about metformin. Fifth one, it is a repeated question. Sixth one, explain the management of diabetes mellitus. Seventh one, classify drugs used in peptic ulcer. Write the mechanism of action, uses and adverse effects of ranitidine. Now coming to the important 5-mark questions. First one, classify the drugs used in peptic ulcer. Second one, neoinsulins. Third one, metformin. Fourth one, antidote for organophosphorus poisoning. Explain its mechanism or the treatment of organophosphorus poisoning. Fifth one, proton pump inhibitors. Sixth one, insulin preparations. Seventh one, oral rehydration therapy. Eighth one, mention the human insulins. Write the indications of their use. Ninth one, describe the mechanism of action and therapeutic uses of ranitidine. 10th one, drugs used in motion sickness. 11th one, biguanide anti-diabetic drugs. 12th one, name the H2 receptor antagonist. Write their uses. 13th one, omeprazole. 14th one, sulfonyl urease. 15th one, enumerate purgatives. Write a note on bulk purgatives. 16th one, metoclopramide. 17th one, treatment of peptic ulcer. 18th one, insulin. 19th, bisacodyl. 20, irritant purgatives. 21, anti-diarrheal drugs. 22, antiemetics. And yes, we are done with this chapter. Before going to the next chapter, I would like to tell you guys that yes, I know you might be feeling that these are too many questions, but trust me guys, if you compare this with the whole syllabus, you will feel it as it's just the 50% of it, because I have concised it and these are only selective questions that were repeated frequently in your previous year question papers. But yes, I can assure you that if you study all these questions thoroughly, you can easily score not just pass, remember, you can easily score distinction in this subject. But yes, it also depends on your answers, whether your answer contains all the required points or not. Basically, it also depends upon the way you present your answer. Okay, so now let's move on to the next chapter, that is genetics. In this, the important 5 or 10 mark questions are: drugs to be avoided in elderly and why. Second one, describe the pharmacokinetic changes in geriatric patients. Yes, this chapter has only these 2 questions which can come for 5 or 10 marks. Now, moving on to the next chapter, that is respiratory pharmacology. In this, the important 10 mark question is: discuss the management of bronchial asthma. Now, moving on to the 5 mark questions. First one, bronchodilators. Second one, write a note on methylxanthines. Third one, therapeutic uses and adverse effects of beta-2 agonist. Fourth one, salbutamol. Fifth one, inhalational bronchodilators. Sixth one, treatment of allergic rhinitis. Seventh one, inhalational glucocorticoids. And add one more extra question, that is why non-selective beta blockers are contraindicated in bronchial asthma. And finally, we have come to an end of this video. Now you have important questions of all the chapters, so it's your time to prepare well without skipping any of these questions. And trust me guys, you can easily score distinction in this subject. But there are only two conditions, that is the first one is you have to read all these questions thoroughly without skipping any one of these. And the second one, it depends upon the way you present your answer, that is whether if your answer consists of all the required points or not, so that if your answer is correct you can score maximum marks per question. If you find this video helpful, don't forget to like, share and subscribe to my channel. I'll be back with my next video. Till then, take care and bye bye.